An elusive closure at a corner bed at the Kenyatta National Hospital's ward for a man whose emotions betray him. Soon after finding his daughter Tuesday, Josephine Sakuda, but that eventuality barely begins to tell her story as seen through the family's experience and highlighted by Citizen TV Monday, 3 days since her disappearance at the Mbagathi District Hospital. A day later and 4 days since she disappeared in the dead of the night from her hospital bed, the mystery is far from being resolved, even after her family eventually found her at the Kenyatta National Hospital.
Hakujua vile alifika hapa. Yeye alipoamka asubuhi yake, alijiona tu yuko kitandani na hakujua alifika vipi hapa. Na nashukuru sana Kenyatta Hospital kwa vile walipompata. Hawakujua ametoka wapi, lakini wakawa ni watu wa roho safi na wakamweka kwa kitanda. Ndio sababu jana tulipokuwa tunamtafuta hapakuwa na rekodi huko chini.
What has since seen the family find fault with the Mbagathi District Hospital's administration?
Security hakuna kabisa.
Hours after Josephine Sakuda is found, we return to the Mbagathi District Hospital to establish ease of access into the wards outside the hospital visiting hours. And so we walk into a hospital known for its proficiency in treating respiratory infections, but one that may on this day be easily accused of laxity. The hospital drawing criticism as we not only move freely and are able to film without any eyebrows being raised as to our unauthorized presence, but we readily access the wards and even manage to engage the patients here as to what is now the biggest topic, the missing Mbagathi patient. Our ease of access in and around the health facility is what raises the red flag over what appears to be a pattern of unnoticed movements in and around the hospital. And so we seek answers, to begin with how Josephine Sakuda, who was diagnosed with meningitis, disappeared from the facility in the first place.
We are having serious problems with confused patients in the hospital. And I must admit that this is not the first case. Almost every month we are faced with the same kind of situation. We have a ratio of 1 patient, 1 nurse to 60 patients, and it is possible that during that, when the nurse is overwhelmed, a confused patient can get out of the hospital.
Such the increasing tales that continue to cast a dark shadow over the facility's reputation.
Our long term is to make sure that we have a perimeter fence in the hospital. We tighten on our security, and we plead with the ministry to increase the number of nurses. And this is really the picture all over the country. We have acute shortage of nurses in the country.
Whether or not this will change the dilemma that the victims continue to grapple with as they seek medical care. Sally Mbilu, Citizen Live at 9.